So, good morning, everyone. I know it's the fourth day of the conference, and thank you so much for making it for an 8:30 a.m. side event to discuss a very important topic today. We'll be discussing from hazard to harmony, rethinking sanitation policy for water protection and worker safety. I think that brings together two very important aspects of the work we all do together in the water and sanitation sector. And particularly in today's session, we will be discussing risks and challenges associated with specifically non-standard sanitation systems, and with a focus on how these systems impact environmental pollution as well as worker safety. So we will have a couple of presentations followed by a very interesting panel discussion, and this session is brought to you by the Indian Institute for Human Settlements, IIHS, Water Sanitation for Urban Poor, SNV, and Waterloo. So without further ado, and before we proceed into the session, I want to make sure that the speakers online can hear us all right. Okay, I think so. Okay, so first up we have a video, which is a very important one because we want to start off the session using some very important voices from the ground. So we have a compilation of what workers have to say from across Africa and India, and also from Pakistan. So let me play the video. Okay, many files opened.
Changamoto zipo nyingi sana ndani ya jamii. Kwanza jamii wanatuchukulia kama walevi fulani, watu ambao labda hawana kazi. Yaani wanatuchukulia kama ni watu ambao ni waajabu sana. Kuta saa nyingine kupata maradhi ama kujisikia vibaya, saa nyingine unakutana na kinyesi ambacho si kizuri, unakuwa unajisikia vibaya, kutapika, unaona bana.
एक ने एक पकड़ो, वो एक ने एक पकड़ो, चारों नीचे चले गए। पता ही नहीं पड़ा भी कहाँ है। 25 बाई 30 का गड्ढा तू राउंड बंद है। दिवास की रहने वाली होती भी
ரொம்ப கஷ்டம் மேடம், பயங்கரம் வலி. ஒரு ஓசம் தூக்குறப்ப ரொம்ப வலிக்கும். நைட்டு வந்து பார்த்தா உடம்பெல்லாம் வலிக்கும், ரொம்ப வலிக்கும். ஒரு ஓசு பார்த்தீங்கன்னா விழுந்தா மண்டே டாரா ஒட்டஞ்சிடும், அவ்வளோ வெயிட்டு ஒரு ஓசு.
Ina umar magaji gidajen manyan yanzu akalla na kai shekara 20 da wani da biyu haka muna wanga aiki. Akwai matsaloli bisa wanga aiki. Wani mutum wanga aiki sai ga mutum ya karye saman shi mu ba mai taimaka mai, shi kenan mutum ya zama. Wani mutum ya taka wani abu kirtanin su haka komai dai ba ba samu cikin wanga aiki. Kuma mutum da inda bai taimaka ga ba mai taimaka mu.
खोल दो लाइन, हमने लाइन खोल दी, कम से कम 1 घंटा लग गया। अब बोला भाई 1 घंटे में तो 500 रुपये ले रहा, किस हिसाब से 500 रुपये तो सारा दिन दिहाड़ी करके तब लेगा। मेरा सर एक बात बताओ, ये तुम्हारी लैट्रिन में मैं हाथ डाल रहा हूँ, छिट्टे मेरे मुंह पे जा रही है, हाथों पे जा रही है, कपड़ों पे गिर रही है, तो तुम तो कह दिया 500 रुपये।
फिर उसको सुपरवाइजर दरोगा उसको धमकी देते कि तुमने छुट्टी मारी थे, कैसे मारी, जा घर पे बैठ जा, नहीं ले रहे काम पे। अगर किसी के मुसीबत है, बीमारी बेचारों को रहेगा। इतना सब कुछ होने के बाद भी जैसे लोग उसके कोई सपोर्ट में खड़ा होता है तो उसे भी कोई धमकी दी जाती है, तुम क्यों बोल रहे हो बीच में।
अजी काम करते हुए हमारा सबसे बड़ा जो मसला है वो सेफ्टी का है, क्योंकि सेफ्टी का हमें सामान तो दिया जाता है लेकिन वो ना होने के बराबर है। और मेरी गवर्नमेंट से, अपने इदारे से ये रिक्वेस्ट है कि हमें जो सेफ्टी का सामान है ना, वो प्रॉपर सेफ्टी का सामान दिया जाए।
So yes, so those are the voices from grounds and some very pertinent issues like safety at workplace, the kind of work environment they work in, and also even the sizes of the septic tanks, which were non-standard, really huge tanks, and all these nuances were mentioned in these videos. And we will be discussing all of this in depth, and to sort of set the stage for the entire discussion, we now have a framing presentation by Niladri Chakraborty from IIHS, and the presentation will speak about the complex dynamics and how inadequate sanitation systems and the regulatory gaps sort of contribute to the health as well as the environmental risks. Over to Niladri.
So once again, good morning all. It is privilege to set the stage on behalf of IIHS, SNB, WaterAid and WSUP. Today we are going to discuss a subject which is often overlooked but equally important. We have a very impressive lineup. We'll be hearing a couple of presentation lineup. But here, next 5-6 minutes, I'm trying to set the context. What is the thing we are trying to demystify? So without much ado, let me go to next slide. Some statistics I'll be presenting, which is not good to start the morning with, but this is what it is. And since these data are available from India, I work in India, so I'll be presenting. So you can see from 1993 to 2024 in India, more than 1,200 sanitation workers died during septic tank cleaning or sewage unclogging. And this is a government data. It is available in the public domain. So the cause of death is not available in the public domain. The postmortem report, etc., we can access. So we keep on hearing maybe cause of the inhaling the poisonous gas, or many times people keep on telling they are under the influence of alcohol, they fell down, etc., etc. It's a very gray zone. Okay. So we in IIHS, because we intensely work with the sanitation worker in one of our largest program, for 2 years, it is from 2019 to 2023, we try to track down, I would not say it's a very scientific study, we just took data what was available in media to try to understand when the death was reported and what was the cause, at least media is telling. So we tracked down 62 cases and it is presented here. I will be requesting you all to take a note ki what are the causes of death. C33 is asphyxiation. You know what is the cause of the asphyxiation. Drowning, fall, these are the reasons. There are other reasons also, electrocution, road accident, etc. But I will be particularly requesting you to take note of these three things: asphyxiation, drowning and fall. It has some connection with my subsequent slides. Now moving forward, see, now all the experts who are working with the sanitation worker, there are plenty of study empirical, we know this occupation is hazardous. And there are lots of hazard when they are emptying the septic tank or unclogging the sewer line. They are coming across. It has subsequent risk, etc. Here I am trying to put couple of hazards, not all, putting in a two bucket. Some of the safety hazards and some of the health hazards. As you know, safety hazards which actually causes the injuries, etc. Whereas health hazard impact your health. So in that hazards, almost 13 hazards also, I tried to highlight some of the hazards. Trip and fall, for an example, fire, explosion, confined space in the safety hazard side. On the health hazard side, toxic gas, biological gases. The highlighting reason is there. Why so many hazards, but why I have highlighted certain things. For that, we have to go to the next slide. This is, I think, very familiar photo. There's one photo where we are seeing one MTR trying to empty the septic tank. Which Abhilasha was also mentioning. In our experience from India, and I'm sure it will be experienced. Many of you who are working in Africa and Bangladesh, most of the time septic tanks are not as per the standard, and also the sewer line when it gets unclogged. So if you go slightly deeper, you'll understand all the hazard I mentioned in my previous slide actually is here. Whether it's a confined place, whether the toxic gas emitting, whether fall and trip, all is here. So then what the point I'm trying to make here? Point I'm trying to make here is that for last couple of years, at least globally, sanitation worker who actually used to be very invisible community, but now in the National Sanitation Program, we are considering them. Government is also considering them. I can tell from Indian experience, I'm sure other, but still the focus was predominantly on the PPE, as if PPE is the panacea. If you give PPE, every problem will be sorted. Then tools, mechanism, of late we are hearing lots about the mechanization mechanism. Mechanism is still there. Then SOP, the advisory prepare, give a SOP or some trainings. So PPE heavy, but these things also here. But in the safety or occupational safety, if we look at the hierarchy of control, you know this PPE is the least effective stuff. This is coming. So we are mostly working or trying to working on the protection mitigation stuff. We are not talking about the elimination of the hazard. Now, first thing is that elimination of hazard completely possible if sanitation workers stop functioning, if they are not doing empty, if they are not unclogging. But the ground situation is not telling us that very soon that is going to happen. Everything will be done by robot. There will be no human intervention. So for some time, I think they will be doing this thing. And then, I am not telling these things are not important, PPE or tools or SOP, but I think equally you have to give an importance to the elimination of the hazards, which is at the top level. And again, I'm not telling work has to be totally stopped, that is not the possible, but if this sewer line, this septic tank, if they are properly constructed, properly monitored, to a major extent, these hazards can be taken care of. Now, having said that, again, I am taking example from India because there I work. So, why these things are not happening? Since we are telling, is this nothing at ground? No. If you look at the Indian experience, there are plenty of things which can be instrumental in avoiding all those hazards. There is a prohibition of, which is called Manual Scavenging Act. That is a very old act, and it is again amended in 2013. There are building bylaws which actually talks how to construct the containment. There are IS code separately for septic tank, for delineation of the underground sewerage. That also talk about the standard. A septic tank should not be more than 1 meter length, what will be the depth and height. Because now you can connect. I have pointed out there are cases where there's a drowning, where because of a deeper septic tank people fall and died. Or people are not constructing the vent pipe, which could have avoided the gas buildup. Or people are, so it is there, things are there, public health acts are there, it is there. But somehow the implementation monitoring is a challenge, I think in many countries is not there. But I don't want to end with this green situation. Yes, it is there, problem is there, but I would also love to tell you that narratives are getting changed. So I start with India. India of late now, from this giving just a PPE or giving training from there, they are shifting their gear. They realize the containment from there, we have to fix the issue. So there is a new directive came from the ministry where they are enforcing on the building bylaw, implementing the construction has to be right. It has to be emptied on time, sanitation worker, because it is not just about the, and here also one point I missed out, which is the thing, because these containments are also not constructed properly, this is also adding pollution load to the environments. So it's a two-way problem. One way the safety issue of the sanitation worker, one way it is not. I am also talking about the underground sewerage. Mostly we talk about this MTR. We have a CPHEO guideline, Center Public Health and Environmental Organization, who talks about fixing a diaphragm chamber when household should be connected with the sewer line, so that it can prevent all the solid waste, plastic waste getting into sewer, which is the major reason of clogging sewer line, right? An old reason. But implementation is a challenge. Nobody does this thing, right? So yes, mechanisms are there, things are not happening, but on the flip side, new things are happening, and it's not just India. All the colleagues where we have joined hand in their respective country, whether it's Bangladesh, Nepal, Zambia, Tanzania, something or other thing is coming up for the betterment of the sanitation worker, for the safety of them. Just one imperative for India, for all my colleagues here, is having this guideline or policy in place is not just enough. So we have to make the things is also getting implemented right on the ground. I am sure today we are having such an impressive panel. Through this discussion, we will definitely get some of the actionable items, some of the actionable plan which is spark, and we'll get definitely a good solution to move forward. This is my last slide. Before just closing, I'd also love to say Indian Institute of Human Settlement, we are working in the down south of the India in a state called Tamil Nadu. For last 10 years almost, we are supporting government of Tamil Nadu in reforming their entire urban sanitation across the chain. Total target population is 30 million population. We are working in 649 urban local bodies through the government. So I was just telling just because of scale. And this program, TNUSSP, and we also implemented a citywide inclusive sanitation is one of the city called Trichy, it's a million plus city. These are the work actually help us to understand many of the things which I am reflecting upon. So thanks to that program, and on this note, I will be concluding here. I will be handing over to Abhilasha. Thank you for your attention. Thank you.
Yes, so thank you, Niladri, for setting the context so well, and I'm sure we are all on the same page now to listen to the experts and champions who are going to speak to us, and also to sort of understand what we are going to discuss in the panel discussion today. So in the next section of the side event, we are having, sharing successful strategies from champions and experts on the ground. And we have with us a lineup of 3 speakers who will be giving very brief presentations for all of us. Let me just put this down. Sorry, give me a minute. First we have Kish Baba. I hope you're online. He's the Executive Secretary of PASA, and he will be sharing his experience with us now. Kish, can you hear us all right? Yep.
I'm here. Can you hear me?
Yes. Yes. Yes.
Okay.
Okay.
Okay. Good day to you all. I am happy to join this meeting and I bring you greetings from Cairo, where I'm presently based. Let me share my screen.
Yeah, we can share your screen, but it's not in slideshow mode.
Yes, you see it now.
All right. Okay, right? Yeah.
Yeah.
Please go on.
Okay. I'm trying to get it to full screen. So my name is Kit Bauer, has been introduced, and I'm the Executive Secretary of the Pan-Africa Association of Sanitation Actors, PASA. I want to talk to you briefly about a piece of work that I did in my previous life as the sanitation manager for AMCAO, the first sanitation manager for AMCAO. And I will start by telling you, drawing your attention to the fact that out of the about 800 million people without access to sanitation in Africa, the rest of the people that have access actually have only 13% of those, less than 13% use sewer networks, and the rest use non-sewer sanitation. But interestingly, all of the people with access, the fecal sludge that is taken and emptied, only 1%, about 1% of it is treated. So it's a big issue. And I used to say that because of that, actually the access to sanitation and open defecation is higher than we think. So we thought that while I was at AMCOW, we believed that because we were then working on giving political direction and policy advocacy for the water and sanitation sector. We tried to start with the policy. And because we realized that there is weak sanitation environment, and so I supported 4 countries to do sanitation policy, but we realized it took like 4 years to finish. So we thought, okay, what can we do to help countries to be able to accelerate the policy development process? And the ASPG was born. And the ASPG it has within it the process for developing a sanitation policy, but it also has within it the template that will guide in developing an inclusive, gender-sensitive sanitation policy. But also, it became a tool and a platform that catalyzes dialogue to improve the sector, because the process of development the ASPG involved many countries within Africa and outside Africa and different stakeholders discussing the issues of sanitation. So the ASPG addresses the key elements of sanitation governance, which includes policy, regulation, sector coordination, capacity, funding, monitoring, and evaluation. But also, it helps give guidance on how the vision, the objectives, and principles of sanitation policy can be shaped. It also takes care of issues of hygiene. But interestingly, relating to sanitation management and the issue of standards, the ASPG is covered under a section that talks about sanitation systems and services, and this is the biggest part of the guidelines. So in that section of the ASPG, it tries to look at what you need to do to safely, manage fecal sludge. It also describes different contexts and systems for sanitation services. It looks at how vulnerable groups can be included in the policy development and implementation process, because the ASPG also has an implementation plan template. But it also looks at the issue of sanitation workers and sanitation work, rapid urbanization, climate change, emergency, disaster, public and rural sanitation. So it looks at how all of those things can help to strengthen the standard, maintain the standards for prescribed standards for sanitation improvement and also management. And so if one is using the ASPG, the guidance is clearly laid out there. So in conclusion, I think because I have worked across the continent and at national and subnational since I launched the ASPG, I have learned a couple of things from it, and I will summarize sanitation policy development under 3 Ps. The 3 Ps are policy, people, and plans, and sanitation policy and implementation under 3 Ps. The policy is that under policy, I will recommend that because policy, it is possible to put everything under policy. We must focus on how we address the sanitation value chain, looking at the building blocks for sanitation governance and other issues. Now, so policy development can be very, very, and implementation must be a multi-stakeholder process that involves all the stakeholders. And then on the people, we must look at the sanitation work and workers, because they are very, very important. And I'm not looking just as sanitation workers. I'm looking from the entire value chain. If you look at under policy, under institutions, of course, policies are implemented by people. Institutions are managed by people. Under service delivery, we must look at the people. So we must look at all of that across the value chain. Then the third and the last is plants and processes. Most of the fecal sludge that is emptied is dumped in the open. Thereby, you can see that the open defecation is not reduced because people have access to sanitation, but is increased also because we are emptying and dumping in the open. So what do? We need to build fecal sludge treatment plants. I know many countries where there is none. There are millions of people that have access to sanitation, but there's no treatment plan, and it's emptied in areas where poor people live. So when we build the plans, there will be guarantee that the plans will help us to structure the back end, all the processes across the value chain back to containment. Then we look at the systems and all the enabling factors. And so PASA has an initiative called the One City, One FSTP that will advocate for this process. And I look forward to working with all of you to ensure that not in the implementation of sanitation policies, we look at the entire value chain and we start thinking of building fecal sludge treatment plants. Thank you very much.
Thank you, Kish. That was a really powerful message. The 3 Ps, I'm sure we'll all take it home today. Are there any questions for Kish? We could take 1 or 2 questions. Okay, all right. If there are questions, I'm sure he'll be around for some more time and we can take that. So next we have a presentation, which is a recorded presentation of Ruth Kennedy Walker, who's a water supply and sanitation specialist from the World Bank. And let me just get it on.
Hi everybody, my name is Ruth Kennedy Walker and I'm a Senior Water Supply and Sanitation Specialist with the World Bank based in Dar es Salaam. I'm really excited to be able to join you via video today to talk about some exciting work that we've been doing over the last year, working with the government of Tanzania on trying to improve the conditions for sanitation workers. Globally, the World Bank, along with organisations like ILO, World Health Organization, SNV and WaterAid have been working for many years now on the initiative for sanitation workers. This relationship is also being strengthened and the partnership is continuing in specific countries globally, including in Tanzania. So in Tanzania, since 2020, partners such as WaterAid and SNV have been working very closely with the government in Tanzania to understand the issues that sanitation workers face. This includes doing a study focusing on sanitation workers working in cities such as Dar es Salaam, Dodoma, Arusha and Shinyanga to really understand the plight that they face and the things that we can do to better strengthen their working conditions, occupational health and safety and overall safety. So what was in Tanzania, we have a case where in 2022 there was guidelines developed that were supported by GIZ on sanitation worker safety, and these were developed by EWORA, which is the Energy and Water Regulator Authority. Now this was a really big step because obviously it was looking at things like occupational health and safety, it was looking at workers' rights, it was looking at working conditions, but it only covered the section of sanitation workers that work for formalised water supply and sanitation authorities. That's what we call them in Tanzania, basically utilities. So urban utilities, the guidelines really covered those workers. and they were recently actually translated with World Bank support into Kiswahili. But really, what the study that WaterAid and SNB found, that there was a large subset of workers, so those usually employed by governments or companies outside of water supply and sanitation authorities, and maybe those that worked for CSOs and formal groups as individuals that were not covered by those guidelines. So that's where we as a group, so WaterAid, SNB, ILO and the World Bank, and even WHO, reached out to the Ministry of Health because we could see from all the past work that there was a gap. And so Ministry of Health were really very open and willing to work with the partners to develop guidelines for sanitation workers that would cover the other subsects of society that were not covered by the original guidelines that Awara had put out. Obviously, the new guidelines refer very heavily to the Awara guidelines because they are very good, but it really resonates and focuses on the type of duties that those maybe workers as CSOs and other those working in other entities or as individuals may need. This includes advocacy for recognition and other benefits, improved working conditions, occupational health and safety, as I said, better representation, better, so they, things like they can negotiate with employers, and awareness and respect, how they engage with community, professional development, job security, workers' rights, things like that. And as I say, also occupational health and safety, because that's an important thing, because we know many sanitation workers face issues when it comes to safety because of the type of infrastructure that they're having to work with, and also because there's often a lot of stigma around the role, and so they're doing it precariously, often at night, doing it so that they're not, that they're not to be seen. And so this guideline is really to understand that and try and raise the voice of these workers, because they play obviously a very critical role in society in general, but also a critical part of the sanitation service chain. And so we've been working with the government over the last year. The guidelines were actually launched in an event in Shinyanga on the 25th and 26th of September this year. And really, these are now national guidelines on health, safety and dignity of sanitation workers that have been launched and ratified by the Ministry of Health with support from all the different donors. And then the idea is now to really sensitize local government authorities, district councils, development partners, and also, urban water supply and sanitation authorities to really own these. And for example, in places like Shinyanga, where SNB have been working very closely, we see that to really make this happen, we have to translate these guidelines into bylaws. And Olivia is connected today, so he can talk more about that example. But really, in the guidelines, it provides these examples, these good examples, and provide guidance to local government authorities, for example, who want to do more, who want to follow these guidelines and want to make them legally binding. But overall, I think it's been a very positive experience. I think the Ministry of Health have been at the forefront of this, and we're just really excited about the next phase of rolling these out and making them they are very practical, but making them more enforceable and seeing how the rollout goes and refining, etc. But I just wanted to be with you today to share that experience, and Olivia can come in more in the panel. Thank you.
Thank you so much, Ruth, for sending us the recording, even if she was not able to make it here or virtually. And Olivia will also be part of the panel to take any questions you may have for Ruth as well. After one more presentation, we'll be moving into the panel and Olivia will be there. And this was a very encouraging example of how various stakeholders, donors, partners and the government came together for an initiative for the sanitation workers. So that was great. So the next presentation is by Dr. Sophie Bosson. who's a sanitation and wash epidemiologist at the World Health Organization. She's online today. And Sophie, you'll be sharing your screen.
Yeah, I'm just sharing the screen very quickly.
Or should I do it?
That's okay. I think I can do it. Can you see that?
We can see you, not the presentation.
Yeah.
I can see the presentation.
Maybe Sophia.
I cannot do it.
So is there a way to increase the volume?
Yeah. Presentation mode.
Yes.
Yes.
Is it better?
Yeah.
Yeah.
Okay, super. Okay, thanks. Okay, well, good morning, everyone. My name is Sophie Boisson. I work in the WASH unit at WHO. It's a great pleasure to be with you in this important session today. In the next couple of slides, I'll be focusing on these two questions, looking at is the workforce sufficient, and what measures do countries have in place to protect the health and safety of workers? Perhaps I don't need to get into too much detail on these slides, but it's just to highlight that sanitation workers do many different types of jobs across the entire sanitation service chain, ranging from toilet cleaners to septic tank emptiers, sewer cleaners, and workers at the treatment sites. Many of you, I'm sure many of you have read the initial report that was published by organization, part of the Sanitation Workers Initiative, which was called Health, Safety and Dignity of Sanitation Workers. And in the report, there was a number of knowledge gaps that were identified. One of them was to quantify the sanitation workforce globally, so to look at what's the existing workforce, but also what would be needed to achieve SDG target 6.2. So we wanted to see what data was out there that could be used to possibly make some regional and global estimates of the sanitation workforce. So jointly with ILO, we explored the ILO harmonized microdata. So the ILO collects data from existing household surveys that are compiled by national statistical offices. So these are largely labor force surveys. And that database includes currently 11,000 household survey data sets across 161 countries. So we really looked at workers in the sewage industries, and this is based on ISIC, or the International Standard Classification. So they have data on category 37 for sewage, but also of interest on category 36 for water, for workers in the water sector. And there was a publication in a blog that also kind of looked at the similar data, but often the analysis combine workers in the water and the sanitation sector. So just a very quick glance at what we've seen, and this is just kind of preliminary data. We find that 71 countries had data on the total number of sanitation workers. Unfortunately, many of these data were tagged as unreliable, often because there's not enough sample observations. So effectively, we end up with 32 countries with data on the number of sanitation workers. The latest survey points were between 2014 and 2022. And I just wanted to show on the graph that really compared to data available for the water sector, for sanitation is a lot less, as you can see. So clearly we can see there's important data gaps there. The database also includes some data that are disaggregated by sex, occupation, occupational skills, whether workers work in the public or private sector, as well as the unit of production and employment, so formal and informal. However, what we found is really very, very limited data with very small sample observations, so making them very difficult to analyze. So that's really questioning the feasibility of using modeling and producing regional and global estimates. But also there's a number of issues in terms of interpreting those estimates. For example, looking at, for example, the level of automation and level of mechanized processes. So I think it's not as straightforward as we would think. But we'll be doing a slightly further analysis on these data sets, but I just wanted to give you a quick picture of some of the challenges that we have with regards to data. We also looked at the data from the UN Water Global Analysis and Assessment of Sanitation and Drinking Water, which collects data on wash systems. The latest data sets published in 2022 included data from 124 countries, and those are highlighted in yellow, green on the map. At the bottom, you can see the distribution across world income level with a quite even distribution, but of course, expectedly the highest proportion of countries in upper and lower middle income category. Is the sanitation workforce sufficient? Well, as you can see on these slides, 22% of countries reported that they had over 75% of the human resources they needed to perform key sanitation functions overall. And the graph shows human resource needs by key sanitation functions, so including policy development and planning, monitoring, evaluation, regulation, management of design and construction, community mobilization, and operation and maintenance. And what you can see, the same patterns is visible across those various functions. So despite the shortages identified, about a third of countries reported that they had plans and strategies in place to address those gaps. And only a quarter said they had enough supply of trained professionals annually from training institutions to manage sanitation system. That's an interesting figures, and also we can think of very different challenges faced by low middle income countries and high income countries. For example, in low middle income countries, we know that sanitation workers operate largely in the informal sector, so that represents a large opportunity to tap into this workforce and formalize and train this workforce. But in parallel, we see that in high-income countries, a significant portion of the workforce is nearing retirement age, which create skills in gaps as experienced professionals retire and there are not enough young workers entering the sector. Here on the graph, we could see some of the main barriers that were cited by countries to HR capacity for sanitation. You could see on the left-hand side that financial resources comes very frequently, of course, but also insufficient training programs or courses that meet demand, as well as lack of awareness of job opportunities in the sector, or gaps in competencies of the staff to perform their duties. So now looking more closely at the measures that are in place to protect the health and safety of sanitation workers, we can see that a lot of countries reported that their policies and plan included such measures. Slightly less included those measures in national legislation and regulation. But when it comes to implementation, only 31% had regulatory authorities that enforce minimum protection measures for sanitation workers in urban settings, even lower in So this graph shows the types of measures in place, and darker green shows countries that reported that those measures are fully in place, and lightest green is no measures are in place. You can see from these graphs that, again, there's major gaps, but also major opportunities for strengthening a lot of areas, including operational guidelines for workers' health and safety, training, formalization, personal protective equipment, and inclusion of risk to workers within risk assessment. That's my last slides. I just wanted to highlight some of so how WHO is supporting this area of work. So as part of the Sanitation Workers Initiative, together with partners, but also through the different guidance and tools that are available. So first, RegNet, of course, and you may have heard about this earlier in the week in the plenaries. Which is the WHO's network of drinking water and sanitation regulators, which includes support and exchange on issues, including related to workers' health and safety. And that includes the forthcoming launch of a roadmap for advancing sanitation, which we'll touch on relevant aspects. Of course, the WHO guidelines on sanitation and health include key recommendations as well as practical guidance for reducing occupational health risks, and together with some of its implementation tools such as sanitation safety planning, as well as sanitation inspections, and we'll be releasing later this year a user guide for sanitary inspection, which gives a concrete example of how these are used in different contexts and different countries. Finally, on the monitoring, so as part of the last round of class data collection, these new questions focusing on the sanitation workforce and their health and safety were added, and they will be maintained over the next cycle. So we'll have additional data in the coming year also. With that, I will stop, and I'd like to thank you for your attention.
Thank you, Dr. Sophie, for bringing in the perspective around data on the sanitation workforce. And it's very interesting that we've seen two triangles today in the presentation. One is the hierarchy of controls, which moves from PPE to elimination. And we saw another inverted triangle in Dr. Sophie's presentation, which shows us from policies, plans to the implementation. So I think we need to keep both in mind as we reflect and discuss more about the topics that are being discussed today. Are there any comments or questions for Dr. Sophie? Otherwise, we will be moving into the panel discussion. Okay, it's a quiet room. Okay, Andrea has a question.
A very easy question for Sophie is when do you think we will be able to have estimates for the sanitation workforce? Did you hear that? Yeah, I was asking a very easy question, that when do you think we will have estimates, global estimates for a sanitation workforce? You are on mute.
Sorry, that's a classical error. That's a good question, but I think even if you do, even if you use modeling, having only using modeling based on only 32 country data points, even if you have multiple data points per country, I think it's very challenging. So, and that's something I think we need to discuss further with colleagues from the ILO, but I personally think there's a number of limitations in producing global, even regional estimates with very limited amount of data. I'm not saying it's not possible, but I'm saying that we have to, if we were doing such modeling, we have to be very clear about some of the limitation associated with that.
Because my question was also like, in the future, do you think we will have more countries, or it's not something that is routinely collected and that the basis will improve naturally?
I can't really answer for colleagues from ILO, because they have the data through ILO stats, and most of this comes from labor surveys. But I mean, what we've seen is that data are improving, and they're getting more information from those surveys. So I think you know, as data collection and data increases, then obviously we hope that we'll be able to have a better picture, or be able to do more in terms of quantifying this workforce.
Thank you. Thank you, Dr. Sophie. Can we have a round of applause for all the presenters? We move into the last section of our side event today, where we have a panel discussion, and I'm going to leave the floor to Andres from WaterAid.
I'll do it. I can just call people and
Thank you. So, yeah, we will move now. We have had a bit of an overview of some global or regional experiences for, and the case of Tanzania also, but to understand some of the frameworks and guidelines that are being used in terms of trying to improve sanitation systems, standards, management, and protect the workers. And the idea now is to move to a panel where we can have some country experiences, learn from in practice how are some of these frameworks or some other ways of and having the right policies, the right enforcement mechanism to improve worker safety and the quality of the infrastructure and reduce the environmental impact. So I wanted to invite the panelists to join me here. First we have Niladri Chakraborty from IIHS, Uttam Saha from WSUP, and Maria Carreiro from SNB. And we also have Olivier Germain online if the technology is with us. Great. Thank you. Thank you for joining. My first question would be around, in your country, in your context, what are the, how are containments built, and are there any guidelines or any enforcement procedures? Sorry. So trying to reflect a bit on that in terms of, and with this idea also of the impact on environmental protection and worker protection. So we can start with you, Maria, if you want.
Sure, thank you.
And there's the microphone. Please.
Thank you, and good morning, everyone. It's off. Thank you, and good morning, everyone. Thank you for the question. So, in Zambia, which is the context I will be referring to, containments are built pretty much according to the wish of the household owner. There are currently what exists is the Public Health Act from the 50s that has been updated since, but the section on sanitation pretty much states that the houses need to have a sanitation facility, but it doesn't say exactly what the standards are for those. And then in practice, what happens is that there's no inspection of the sanitation facility when a house is being built or reconstructed. And the reports we get from the masons is that essentially people want a sanitation facility that doesn't fill up very quickly. So the tendency is to have unlined pits. If it's a middle income or higher income household, we can talk about septic tanks, but more often than not, more in name than formally speaking. So yes, essentially that's what happens. That's how the toilets are currently being built in Zambia. Thank you.
Okay, thank you. I can share the experience from Bangladesh. In Bangladesh, basically we have Bangladesh National Building Code, which we call it BNBC. So initially, this code was mainly looking for the establishment of housing, how much actually the open space is there, so the fire brigade or any ambulance or any other things they can move. You know that Bangladesh is very densely populated country, so they were mainly focusing on this aspect, but there was nothing to for the tanks or the toilet part into the building code. And what happened, like we saw in many cases, actually the tanks are built in such a way, so there is no space or there is no way to go and empty the sludge. So this was a big issue, and this was reported from the different municipalities and the workers. So that's why then the sanitation department, especially the Department of Public Health Engineering and some of the members from the Fecal Sludge Management Network, including SNB, was also there. So we just helped the government to develop a guideline on how to construct the appropriate toilet, including the location and also the size of the toilet and the number of the toilet. So that has been included into the national building code. So this is not a one-shot go. Like now, if the people they want to take the approval for establishment of their house, so there are some things already in place for the containment part. But the establishment who is already are there, so and now we are also talking about that how the retrofitting and other issue can also be a part, and also we are in the process of dialogue that how the municipality, especially the sanitation supervisor, they can periodically visit and monitor the overall status of this containment to make sure that the fecal sludge are contained into the containment, not leaking to the environment. So that is the part for Bangladesh. Yeah.
Thank you. I'll be sharing experience from India. To me, that containment itself is a paradox. So it has both sides. If you look in India, I have already presented during my morning. Policy, regulation, etc. is very much there. Okay, so we have a IS code for constructing containment. We have IS code for delineation of sewer line since 80s, 85. Okay, and we have combined building by rule, which is conferring power by all these building laws or IS codes. It is there. So when someone need to construct building, the entire process is done through the town planning departments. You have to apply there. You have to give a declaration key whether you are constructing a containment or not, etc. But after that, the things started to get diluting. Here mentioning I am constructing containment is enough. They are not mentioning what is the dimension, how is the user number, what is the location, whether nothing. So entire thing has been automated, screening has been done through computer system, but it is just a checklist, containment yes or not, enough. Once the plan get passed, then it is totally with the household, as Sophia and Uttam mentioned. And why I say paradox, engineers say, I don't know, in civil engineering, I have never learned how to construct a septic tank. Machine says, sir, what to do, as household say, I do. So, and household say, I am not a sanitation person. No? The machine saying, I have to construct a big tank so that I need not to empty. So it's a paradox, and that is the thing. So in that way, as I mentioned in the morning, many times, like Sophia also mentioned, they keep it unlined. So continuously it is leaching out. It is nowhere close to a standard septic tank. In India, we started calling it a big holding tank. And because of the depth and all this thing is not measured, many times you will not find vent pipe. Of course, it's becoming a trap for the sanitation workers when they are coming for the emptying. Yeah, this is the ground situation.
Thank you. Olivier, over to you.
Good morning, everyone. Good afternoon from Tanzania. I hope you can hear me.
Yes.
Yeah.
Yes? Okay, good. So my name is Olivier Germain. I'm the water sector leader for SNV here in Tanzania. So I'll be talking about Tanzania case study. Specifically in Tanzania, one of the good things is that there are some very specific national sanitation operational construction guidelines. And they're very much focused on providing a lot of detail around the dimensions or the engineering part. That is very well covered. And recently there was also an effort to upgrade those to really have more elements around gender and social inclusion aspects within infrastructure construction. And the issue is more in terms of obviously the uptake of that guidance. Technically, a lot of the masons do have the technical knowledge, but as others were saying, often get overruled by the customers. And we see this both during the construction time, but also during kind of emptying, when the emptiers come and they ask for the wrong part to be emptied. So I think there's in terms of the enforcement part, obviously environmental health officers can't be everywhere all the time. They do have knowledge of the guidelines, are able to do so. There is a need to marry the guidelines and enforcement part with a little more behavior change and awareness campaigns in terms of the customers, so that they can also have more say and more guidance in terms of proper constructions. And the other aspects that I would mention in terms of the guidance is not only the dissemination of those, but when the masons are actually doing the work, it's not only the technical skills that are required, and the work we've been doing here in Tanzania has also been in terms of the kind of marketing and business sense and building their confidence to be able to sell different options that are more suitable to the demands of the customers, and really building those negotiation skills so that they can kind of put in place something that is actually going to be working and is in line with the guidelines that have been set. Thank you.
Thank you. Great. So I think if I had to summarize the experience across the three countries, it looks like there are guidelines, more or less, better or worse, but there are some guidelines in these countries. But basically, what is built depends very much in the interaction between the household and the mason, and doesn't necessarily speak to those guidelines, and that has implications in terms of both environmental safety and also the protection of the workers. So to lift our spirits a bit, the next question is about, and Olivier, for instance, has already mentioned a couple of things. What strategies and approaches are there that would help effectively enforce these guidelines, or at least improve the quality of the containment from that perspective of, again, occupational health and safety and environmental protection? Maybe let's repeat the same order.
Sure. Thank you for the question. So in Zambia, what happened was that the national regulator of the sector, NOASCO, they started to develop what were to become the statutory instruments for on-site sanitation and fecal sludge management. Has been a very long process. They're not yet approved. A lot of work has been put into that. The guidelines are extremely comprehensive. They cover the entire sanitation chain. So all the way from the user interface, containment, to disposal and reuse. It's been initiated in 2017 and they're just pending approval. And it was also a very participatory process. So NOASCO consulted local authorities all over Zambia to really understand what the challenges were and develop an instrument that really speaks to the reality of Zambia. So there are a number of advantages or benefits, obviously, to the statutory instrument, but there are also challenges. I'm not sure if this is the moment to speak to those or if a dedicated question will come around that. Well, obviously, the good thing is that it standardizes everything. It says what type of facilities are allowed, suitable. It gives also a range of options. It does leave the local authorities quite a bit of space to adapt and contextualize. It also covers the emptying bit, so everything that has to do with the protection of the workers, in addition to the protection of the groundwater, is also very much explicit in the instrument. Now, the difficulty is, of course, bringing that instrument to really materialize and shape, being implemented, in fact, being enforced. Like Olivia was saying, and others mentioned as well, there are very limited capacities and human resources for consistent inspection that needs to be done. There's also limitations in terms of bringing this information about what these guidelines mean for different actors, because it does carry responsibility for the households, for the local authorities, for the private sector. So making sure all of these stakeholders understand and comply with the guidelines. So there's a lot of effort associated with that. And then there's the very practical aspect of financing, because what the instrument states is that if you are found to have, for instance, a substandard containment, you have a certain period of time to upgrade that containment, and then warnings, and then if you still don't comply, at the end there will be a fine. And this, of course, is happening in a context where a very substantial proportion of the population is in the lowest wealth quintiles. So the ambition is there, the vision is definitely very clear-cut, but then the practical aspects of implementing, of monitoring, and of really bringing the Zambian population and the other key actors to the level they need to be in order for this to really deliver the public health benefits that are sought, well, that part still has a lot of work to be done. Thank you.
Okay, thank you. Basically, in terms of the Bangladesh, what I have said, the issue is now, the information is now in the National Building Code, but this is only a code. But in terms of operationalizing the code, that is actually the challenges now. And in Bangladesh, we do not have any independent sanitation regulator at the moment. But what currently the municipality have, the municipalities and city corporation, they have the sanitation department, and also they have a particular workforce who look after the for the inspection of the sanitation aspects. Not only the sanitary toilet aspects, but also they look the food sanitation, environmental, any other sanitation aspects. So they have very limited task force. So the issue is now that we have altogether 329 municipalities, small and secondary municipalities, and 13 big city corporations. So there is a big workforce out there. So how the issue is now how to train this workforce, and also how to equip so that they can actually develop and maintain this program at their locality. So issue is, of course, the financing, and in terms of the really the fecal sludge management, the general attention when anyone actually talks about the fecal sludge management, so the municipal policy makers, they mostly focus on building the infrastructures like the fecal sludge treatment plant or procurement of a vacuum truck, but not equally understanding the importance of the containment, because we have seen that a number of cases the fecal sludge treatment plant is there, but the plant are not operating at the optimum scale. That means actually the sludge are not going there. So why these sludge are not going there? So containment is one issue, the access to containment is an issue. So that's why now through our fecal sludge management network, we are trying to advocate the national department as well as also the development banks who are supporting large scale programs, so that how they can actually support or operationalizing this guideline and setting up a place for clear inspection of the toilet and taking some corrective measures, so that can make sure that the sludge will be emptied and going to the treatment plant, not going to the environment. So what is the so that's why actually this is a difficult task that we are trying to influence and advocate and with the Bangladesh government as well as also the development banks. Yeah.
So in India also, I must say the paradigm is shifting because like it or don't like it, deaths are happening, accidents are happening, government is under tremendous pressure. Supreme Court is asking question to government why these things are happening. So this problem government now trying to solve in multiple ways. One is current government is very sensitive to the sanitation worker. They are running a campaign called Safai Mitra Suraksha Abhiyan, means Suraksha means safety, Safai Mitra means sanitation worker. So it's a campaign for their safety. So one way they are trying to solve the problem what we are discussing, the risk hazards etc. Through setting up emergency response unit. If some accident happens, definitely some unit will go and rescue them for accident etc. More strongly, heavy-handedly monitoring them with GPS etc. That is they are trying. But on there is another new scheme came called Namaste, which is they are through that scheme they are trying to train how people can operate in the confined space. This is one way, slightly reactive thing, but they are also trying to problem the same problem from this containment side also. So first time building or construction, containment, etc. is no longer just an engineering thing. There's a new advisory came for this from the perspective of the sanitation worker safety. Now this is a baby step, but having said that, as you know, the scale of India is massive. Now it will be still a challenge when it will come down to the urban local body or local, because in containment also many times see there is nobody from the town planning to go and inspect actually how they are constructing the thing. So yes, there is a changes, but still miles to go how it implement on ground and how actually it is become a savior for the sanitation worker.
Thank you. Olivier?
Thank you. Yeah, from Tanzania, not to repeat what has already been said, obviously dissemination of the guidelines themselves is something that is often overlooked. So much effort is put into developing the guidelines, launching them, and then very little is done in terms of investing about how it's actually trickling down to the front line where those are most needed. But one thing that was mentioned by Ruth in her recording, we've worked with in terms of developing some specific OHS, national OHS sanitation workers guidelines, has been the real involvement, which I think Maria talked about in Zambia, of the workers themselves in the process. And even more than the guidelines themselves, that whole process has been really instrumental in terms of building more trust between the kind of enforcers, the local government authorities, and the workers themselves. And it's beyond the kind of safety, physical safety measures which the guidelines are promoting. That development, those discussions in terms of developing the guidelines have built more recognition for the work of the sanitation workers, have built more respect and pride, and that is almost as important in terms of improving their working environment, making them less prone to kind of stigmas and the pressure that they're feeling. So I think really investing that two-way process in terms of developing guidelines and then investing in dissemination is very important. One other thing I would say is in terms of climate resilience as well, that a lot of these guidelines don't automatically or are starting to tackle climate resilience, but a lot of the problems or a lot of the issues of sanitation facilities specifically are also based in terms of where they're sited or the lack of kind of use of some of the data around climate change that can help to improve the sanitation facility and how it's accessed by workers as well. And then the final point would be what Ruth mentioned right at the end, is the guidelines are one good step to be able to help with enforcement, development of bylaws that adopt some of the key elements from the guidelines, really help the people who are trying to enforce those guidelines to have the right instruments to do so. And this we saw, for instance, in Shinyanga, specifically where permits linked to sanitation construction or emptying were very much focused on some of the technical aspects, but completely blind to the occupational health and safety elements. And now those are key performance indicators within the enforcement measures and within the permits, and really kind of elevating the safety of the workers and the people in a sense, rather than just the sanitation construction in terms of the focus. Thank you.
Thank you. Great. Any questions from the audience to any of these countries, panelists?
Thanks. So there's been a lot of conversation this week about guidance documents, and I really appreciated you talking about the construction movement towards construction and building codes. But I'm just wondering, how do we reframe and kind of move beyond the proliferation? We have some guidance documents for safety and health for workers related to PPE. So how do we kind of reframe and move beyond that within the WASH specialists who are creating those documents? How do we move past that, and what's needed to kind of justify or reframe that?
Okay. Thank you. Any other volunteers?
I can
reframe.
So in your presentation, you had talked about asphyxiation being the top.
What we tracked, yes.
Yes, and so is there data that we can collect to kind of show maybe the effectiveness or ineffectiveness of PPE, or what other ways can we kind of justify moving beyond PPE?
Yeah. Okay. Let me try to respond to your questions. Okay. So, yeah, you are right. I mean, I also presented in my in the morning. The initial approach was just to give PPE. PPE will be solving everything. But I also presented hierarchy of control, which is PPE will be last of the resort. So containment, if we construct properly, if we empty it timely, the gas build-up, etc., can be avoided to greater extent. And if many times we have experience from our cities where we work, citizens also insist sanitation worker to bend over to get inside clean, completely clean. Okay, so it is not just about government; it is citizen also have a responsibility out there. Now, but as I told you also, moving forward in India now, this narrative is changing. It is no longer only PPE, people realizing, because when they started giving PPE, then second complaint came, people don't put on the PPE. Now, why they don't put on the PPE, nobody ready to discuss all that. Because to be honest, again, this I am telling from our learning, the PPE which is available, in the first place, sanitation as an industry never we discussed, right? So whatever PPE we are providing to our sanitation worker actually taken from different industry. I am giving him a helmet which is from the construction industry, which is supposed to save their head from brick falling. So this is not very good for the sanitation operation. Or I am giving a heavy duty boot, which my women's sanitation worker can even put, because in India they put a sari.
So point I'm trying to make it that the PPE is kind of just, it's a panacea, give it all, but PPE is also not actually designed to do this operation, and especially the tropical country like India or Bangladesh or Pakistan, because they also keep on complaining, it is slipping off, it is sweating, it is heavy, I can operate with this thing. Okay, so somewhere or other this thing get registered, so that is why now no longer, as you say, PP is there, but government is shifting from there also. Yeah.
I can add some of the experience from Bangladesh. Although we talked a lot about the emptying containment part, but also there is some other advancement, like when you talk about the emptying of the fecal sludge. So it's always considered that only the vacuum tanker is the single technology that can be only used, but to be honestly speaking, there are different kind of informal settlements in every city that there, where actually this kind of vehicle, they can't move. So they need a kind of a small scale pump or any other technology that actually can replace the manual emptying. So it's not only the containment part, but also they need access to this kind of technology, and as well as also if technology is there, then it is very costly. So how they can actually afford it? So how they can access to finance, and how the informal groups actually can take it as a small enterprises. So that kind of issues we are now talking with the government, and the government is already the government, the Bangladesh government have taken another initiative, because although we are talking about the prevention is better than cure, we are talking about the safe containment, we are talking about the every technological aspect. But despite that, there are many accidents are there. So maybe Niladida only proposed about the death, but there are many cases for the disability and other issues. So if that is happened, so how to access the labor welfare fund? So the labor ministry, they have this fund, but unfortunately the sanitation worker, mostly they belongs to the Ministry of Local Council or Ministry of Local Government. So usually they don't have any connection or partnership with the Ministry of Labor. So that's why we have, our government have now, particularly from the fecal sludge management network, we advocated with the Ministry of Labor that how they can treat sanitation worker to access this labor welfare fund. Then they actually proposed, we can only consider if any profession is in the list of hazardous job. So sanitation profession was not there, but we advocate with the Ministry of Labor, and they finally included into it, and they gazetted an order, and we are expecting that in the coming days the sanitation worker, if they face any accident, definitely they can access the labor welfare fund. So we see that we have a kind of a different angle to support the sanitation workers. So containment will not only be the single solution, rather than we are talking about a transformative approach, that how we can really upgrade the life of the sanitation workers. Yeah.
Can I just add? Thank you. We're going to take a couple more questions, and then you can respond to any of those. I think I saw 2-3 hands. You have?
I have a question.
We'll do a quick round, very quickly, please.
So thank you to the panelists. I had questions about the enforcement procedures. I hear that there is an expectation that the consumer or the end user also enforce these procedures. And I was wondering if from your experiences, this is also something reflected in the policies, that the consumer is involved in these responsibilities. And also if from your different positions, you also kind of include or target that population into the enforcement as well. Thank you.
Thank you.
Thanks a lot. I just was struck by Sophie's slide about the insufficiency of sanitation workers. And I was kind of wondering, like, you know, clearly it's a hazardous job, and clearly a lot of the discussion has been on protecting, you know, health and safety. And it's a stigmatized job. So that needs to be addressed. But if you think broadly, and this is where it gets very broad, where do you see this issue workforce incentives going? Is it a matter of trying to get more pay? Is it a matter of trying to have sort of more structured and recognized education? Or is it just we need to focus on those basics and get those basics right, and that's the agenda right now?
Thank you very much, guys. It's been very inspiring. I think I would like to learn from the people, especially in the developing countries. We have more focus on legislation, policy, and in some cases, it's not very specific to our context too.
Yeah.
But did you find any enforcement mechanisms helpful? Did you think that something worked? Because the country I'm coming from, we are one of the most heavily legislated countries in the world, and we have legislation for everything. I mean, sanitation is still not part of it. We still lack sanitation policies, but how to enforce if we are fighting to help them legislate and make policies? So, any examples, any success in order to make it more effective implementation?
Thank you. So you have 3 questions and 30 seconds. Please still respond. You can also follow up afterwards.
Okay, very quickly. Enforcement is indeed the critical challenge, but we see it like it's a range. One should start with behavior change and progressively move towards enforcement. Also because, of course, enforcement is much more difficult to do, is much more costly, and the scale of it is never as efficient. So there are responsibilities at the household level, for sure. For instance, in terms of how they handle the pits, there's a big problem with solid waste being dumped in the sanitation facilities, and that is one of the most precarious contexts for the workers to be in which they have to empty full of solid waste. And my 30 seconds are gone.
Yeah. Maybe Olivier, did you want to respond to any of the questions?
Yeah, sure.
In 30 seconds, sure. So, I mean, in terms of the customer role, I think one of the things we've seen through the behavior change aspects has been that the customer sometimes is a quite useful kind of enforcer, especially when they are paying, quite significant amounts of money for a service, for instance, and then if you associate that with them demanding a more professional service, they can be quite useful. We've seen in terms of insisting on certain measures or certain equipment or certain protocols to be followed. So I don't think they're the chief kind of enforcer, but I think it helps if they also understand to get value for money for what they're doing, that they should be also requesting X, Y, and Z to take place. So I'll leave it at that. Thank you.
Thanks.
Yeah.
Very quickly.
So for me, actually, so the sanitation workers aspect and also different element like the emptying or the technology aspects or the standard, all of this actually very essential to develop a safely managed system. So, but the biggest part is that actually time has come to work with more closely with the big investment designers as well as also the system builders and the system operators. So they need to understand these are the importance, equally important along with the infrastructure. So it is about their understanding, and also not only understanding, after the understanding they should not be idle, it's about how they can take action. So that actually that is the point of where we need to focus on. Yeah.
I want to address this question.
Yeah, very quickly.
So it is purely from Indian context. See, in Indian context, the states we are working, their workforce is not an issue. The problem is that there is a huge workforce in the informal sector. There is a thriving private sector. Okay, and this informality actually adding layer and complexity to all this health and safety issues, because they are not getting their entitlements. They are beyond that. So workforce is very much there. Like Tamil Nadu, 5,000 people are involved in this emptying across the state. Plus there are 2,000 other people in the shadow market. How they do, nobody knows unless they are going. So that is why all these complexities are happening.
Maybe I can add a little bit to do this question.
Yeah.
I think insufficient workforce is a big challenge, and I think from my context, So I'll give you one example. One union council, one unit, we require at least 100 people to work in that. And we have 30 working operational workers working there. Maybe 70 people, they are ghost workers, they are not working. And even if they are working, so the informal part is they have rehired another person because people from another religion, they don't want to work in it, they just want to get salaries. And then they hire one person giving them half of the salary, who is informal, who is not even part of the company. So in case he's dead, he's injured, so he's not getting any compensation because he's not the formal worker. So I think in our case, insufficient workforce is one big challenge, and this is why they have to work in many cases 12 hours, even 14 hours. So I think we definitely are looking at it as an issue, and how to improve, ghost workers, how they should be eliminated from the system. So it's part of the basics for us.
Thank you, and with apologies for being so bad at enforcing the time, I want to hand over to Bruce for a very quick closing remark, and thank you to the panelists.
Thank you both so much. So this is really brief, but every time that I drop in on a sanitation workers event, I'm just really fascinated. I know that Kitch mentioned the 3 Ps, and what struck me was the partnerships around quite many ways, I don't want to say a narrow issue, but one that's quite specific. And it's, we have the World Bank and ILO and WHO, all the partners here. And I remember that wonderful exhibition at the UN 2023 conference and bringing some of the senior politicians there and directors, and they were just so struck. So it's really something so compelling to work on. And I think that we've got this, kind of, when we look at the people, it really, it touches your heart. But what was really great today was just hearing some of the solutions and the guidelines and what has to happen with policies and how we're advancing on regulations. So I think it's really wonderful that we're getting to that point where we're operationalizing things. And even that last discussion around, the unseen worker and some of the nuances around the workforce I found really fascinating. So I just really hope that we can all kind of work together and continue this, because it's really so compelling. So thanks, everyone.
Thank you.
So there is a first aid manual over there for discharging workers, which you can use as a reference. Sorry, we don't have too many copies, and also some badges for you to take as you move on. Thank you so much.
Something's happening.
Let's take a